Hi, I'm David. In this Harris Academics video, we're going to cover the anatomy of the GI tract and serous membranes. Today we'll be focusing on the anatomy of the GI tract in the peritoneal body cavity, so namely the stomach and the intestines, and I'm going to work my way from more general features to the specific. To start at the most general, the stomach is separated from the intestines here by the pyloric valve. Now the intestines have several divisions. Most notably, they are divided into the small and large intestine in this location in the right lower abdomen. The valve located here is known as the ileocecal valve, which is named appropriately because it separates the ileum of the small intestine from the cecum of the large intestine. So what exactly is the ileum? Well, it's one of three divisions of the small intestine. There's the duodenum, jejunum, and the ileum. The duodenum is a very short first section of the small intestine, which serves as a mixing point for the acidic chyme coming from the stomach and the alkaline bile. Now, really the upper half of the small intestine is the jejunum. So its primary purpose is the absorption of nutrients from the food bolus. And the lower half of that small intestine is named the ileum. So it is responsible for continuing any absorption necessary, as well as absorbing vitamin B12 and bile salts. So the ileocecal valve separates the last part of the small intestine, the ileum, from the cecum of the large intestine. And what is the cecum? Well, it's one of a few notable features to learn about the large intestine. The cecum is a pouch-like structure, which marks the beginning of the large intestine. Its role revolves around reabsorbing water remaining in the stool. Extending downward from the cecum is a projection called the appendix. The appendix does not serve any critical role in the digestive process. In fact, some of you may have had yours removed. It is possible for the appendix to become obstructed, which in turn causes swelling. This is known as appendicitis. Now, the obstruction of blood flow and the increased pressure causes that hallmark severe pain in the right lower quadrant of the abdomen. Now, treatment often revolves around immediate surgery, as this is a medical emergency. Removal of the appendix, which is an appendectomy. The rest of the large intestine is broken down into segments. So this vertical section of the large intestine on the right side of the body is the ascending colon. Ascending because fecal matter must move upwards to progress. The vertical section on the left side of the body is the descending colon because fecal matter progresses downwards here. The section in between is named the transverse colon because it follows the transverse plane. This squiggly section here is termed the sigmoid colon. The final short chamber is the rectum. When fecal matter enters the rectum, it's what causes the urge to defecate. Now that we've covered the different portions, it is important to note that the GI tract is one continuous tube. So the histology, or the general tissue layers, is going to be the same throughout. The four tunics, or the four general layers of the GI tract from inside out, are the mucosa, submucosa, muscularis, and serosa. The first layer, mucosa, is comprised of three sections. So there's the epithelium, lamina propria, and the muscularis mucosae. So the epithelium is the first section, which is a thin layer of specialized cells which directly touch the lumen. So in the stomach, the epithelium can dip inwards to form glandular tissue, or it can protrude outwards in the small intestines to facilitate the absorption of nutrients. The lamina propria is made of connective tissue which houses the capillaries that service the epithelium. The muscularis mucosae is a thin layer of muscle which is embedded in the mucosa. The second tunic is the submucosa, and it is made mostly of connective tissue. The submucosa houses the blood vessels, lymph vessels, and nerves which run along the GI tract. The muscularis tunic is formed by several layers of smooth muscle, which facilitate mixing and movement. Now, the layers can vary, with the stomach having 3, being an inner oblique, a middle circular, and outer longitudinal, while the small intestine has 2 layers of muscle, being an inner circular and an outer longitudinal. The final outermost tunic is the serosa. So the serosa wraps around the GI tract, providing integrity with areolar connective tissue, collagen, and elastin. So the GI tract and every other organ in the peritoneal cavity is covered by the visceral peritoneum serous membrane. So for our last topic, let's talk about serous membranes. A serous membrane is remarkably similar to a water balloon, or at least a balloon filled with water. There's a membrane and serous fluid inside. Even though a serous membrane may be continuous, for the sake of specificity, we divide the membrane into 2 parts. The part that touches the wall of the body cavity, like where the balloon here is touching the cup, is called the parietal surface. Let's use our little cake here to represent our stomach, since that's where it goes anyways. The stomach sits in the body cavity like this. The part of the serous membrane touching the stomach is called the visceral surface. I like to think of the phrase visceral reaction, which means gut reaction, to remember the visceral surface touches our organs or guts. And that about wraps us up. To recap, the small intestine has 3 different sections: the duodenum, jejunum, and ileum. The large intestine has several notable features to memorize, including the CECUM and the appendix. The GI tract as a whole shares 4 different tunics, and all of the organs in the peritoneal cavity are suspended by the peritoneal serous membrane. References for this video are from McKinley O'Loughlin's Anatomy and Physiology 3rd edition. Music is by Harris Heller. Titles pack is by Modern Filmmaker. Sound design was made using assets created and provided by Andrew Huang, and a special thank you to Sophia Myers for the design and animation of Florence, and thank you so much for watching. Until next time, take care.